cataract surgery and refractive surgery, it's evolving very quickly. We've been doing it very similarly for the last few decades, but I think the way we do it and how we handle efficiencies in the office and how we keep that elevated level of care has really, really changed. So Bobby, let's start with you. So we've got kind of a numbers problem, it seems like. Our graduating residents in ophthalmology, that number seems like it's been pretty stable, but in optometry and our elevating or our aging population, we're going to have a need for cataract surgery, right? I mean, how do we handle that numbers problem moving forward while keeping that elevated level of care?
Yeah, it's kind of interesting. The one of the surgeons that we brought on recently was actually we were having this conversation, and he was basically saying that, what did he say? He said basically, if you look at the American Academy of Ophthalmology, which normally represents 90-ish% of all, ophthalmologists, if you look at one of the stats there, it was like almost half. It was like more, like 40 something percent of these ophthalmologists in the American Academy of Ophthalmology are over the age of 60. And it's like, huh, okay, that's actually really interesting to just then think about, as we see some of these newer, maybe newer-ish models are becoming more common of optometrists really being involved in refractive and cataract surgery, it becomes interesting just to think about like, what does the future of these kinds of models look like? And are we going to be relying on optometrists more? And I think that if you look at the really successful practices, they find a way to integrate both. And then it becomes an interesting concept of like, okay, if that's the case, and maybe the number of ophthalmology residents isn't increasing, or are we going to rely on optometry more? And then the question is like, how do you get optometry to that level? Because there's really like I remember when refractive surgery talk like in optometry school came up, I was like, why do we need to even learn this? Like, I'm not even going to be in refractive surgery. Yeah, it's kind of funny to think about now, but it's just kind of interesting. Is like, okay, so now if you have these really awesome positions that are out there where optometrists and ophthalmologists can work together at a really high level, the question is like, how do you get the training on board to where everybody's on the same page and really everybody can practice at the highest of their level and lead to potentially some efficiencies and providing great customer service and really providing great experiences and outcomes for patients.
Yeah, it's interesting. I mean, so all four of us on the panel here, we all work very involved with ophthalmology, and we all have, a lot of say about what happens in the operating room, even though we're not necessarily the ones holding the instruments. But back in school, I mean, I graduated, short 10 years ago, and we didn't get a whole lot. I mean, the education was great, and I value my education that I got, but surgical stuff, we didn't really touch a whole lot. And now being heavily involved in that collaborative care model where my opinion actually matters, there seems like there's a little bit of a gap there. How do we learn that? And how do we learn on the fly? Now, I've been blessed with mentors, and I think we all have to kind of take us under their wings. But that collaborative model, I think, is really just becoming the norm. Becky, you guys have an interesting, because you just opened up cold like a year ago, right? Down with
Yeah.
Brett?
Yeah. So Brett and I opened Mueller Vision a year ago last week. So big milestone, which is exciting. And for any of us on the call who've been a part of Cold Starts, it's an adventure. It's a steep learning curve. And a lot of it is hanging on every day and figuring it out as you go. And we've had a lot of fun along the way. But there really is a huge problem when we look at how many ophthalmologists are coming out. If there's 500 residencies a year, how many of those actually complete residency? Brett and I were talking about that one day, and not everybody who goes into residency completes in their desired field. And so even with that, not everybody's coming out with cataract and refractive experience. So not only do we have a challenge of not enough surgeons, our optometry schools really do not have an opportunity to adequately prepare ODs as they graduate for opportunities. And there's a lack there. And so we've all been fortunate, like Nick said, to be blessed with different mentors. And I've been fortunate to work with surgeons across the country who are incredible and have poured into me, taught me a lot over the years, and still more to learn every single day. But with that, we're trying to create a community, a conversation about how do we navigate some of these complex conversations. So Brett and I work hand in hand with the opportunity to see every single one of our patients when they come in for cataract consults or refractive consults, and then help guide them through that experience. And I think a lot of these high volume, high premium practices are looking to shift to those models in the next 5 to 7 years if they haven't already. Nick, when I think about what you and John have created, I mean, you do almost all of the consults. How do you loop John into some of those things?
Well, I think it's a true team. So him and I both have interactions with the patients preoperatively. He definitely values my opinion. If there's something that I think that we could do, or something, maybe sometimes more importantly, something that I think that we shouldn't do, that holds weight, and he takes that into his decision too. And so a lot of these cases, challenging cases especially, where I really, it's amazing to me that he values my opinion so much, that he's been doing this for 30 years, and I don't want to age him or anything, but he's been doing this for a couple of years, and he's got tens of thousands of procedures under his belt. So why would he respect my opinion as the OD who has never done a cataract surgery or a LASIK surgery at all? Well, I mean, it's because of the background and the knowledge that I've developed over the years, and obviously optometry school helps with that. The understanding of the visual system and the optics, and then it comes down to interpersonal relationships. I think the really good optometrists that are in refractive practices and are good at it have that ability to relate to their patients. And I think it's that feeling of developing that small, almost, you make the patient feel like you're their friend, right? And you want to make sure that they're along for the entire journey with you.
It's the art and the science. The science is the optics, of course, which you've alluded to, that optometrists are so beautifully positioned to deal with the optics of things. But it's the crux of the art of it, the art of refractive surgery, which, I mean, has really encompassed more than just refractive, which I know we're going to talk about some other elements that come into that. But it's that art that I wish, you guys are a little bit more junior than my, gray self here. But in school, I didn't learn a thing. I don't think surgery was ever mentioned. And I had to learn everything, piece by piece, clawing through. I've had some fantastic mentors. But how wonderful is it that we're now here, the four of us together at different stages of our careers, able to kind of share and kind of guide the next generation too. I just think it's so beautiful.